Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on Lisinopril. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing we'll discuss in this presentation is what this medication is used for. So Lisinopril treats high blood pressure and heart failure. It is also given to reduce the risk of death after a heart attack. The medication is an ACE inhibitor. We'll now discuss how to use this medication. So first off, take your medication as directed. Your dose may need to change several times to find what works best for you. If you're using the oral liquid, measure the oral liquid medication with a marked measuring spoon, an oral syringe, or a medicine cup. What happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, wait until then and take a regular dose. Do not take extra medication to make up for a missed dose. Be sure to store the medication in a closed container at room temperature, away from heat, moisture, and direct light. We'll now discuss some warnings associated with Lisinopril. So it is not safe to take this medication during pregnancy. It could harm an unborn baby. So tell your doctor right away if you become pregnant. Tell your doctor if you are breastfeeding or if you have kidney disease, liver disease, diabetes, or heart or blood vessel disease. This medication may cause the following problems. So angioedema, which would be severe swelling, kidney problems, or serious liver problems. This medication could lower your blood pressure too much, especially when you first use it or if you are dehydrated. So stand or sit up slowly if you feel lightheaded or dizzy. Do not stop using this medication without asking your doctor, even if you feel well. This medication will not cure your high blood pressure, but it will keep it in the normal range. You may have to take blood pressure medication for the rest of your life in some cases. Your doctor will do lab tests at regular visits to check on the effect of this medication, so keep all appointments. Over the next couple slides, we'll go over adverse events or side effects. Over the next 2 slides, if you experience any of these, you would want to get in touch with your physician right away. So it could be an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness, or trouble breathing. Contact a physician if you have blistering, peeling, or a red skin rash, a change in how much or how often you urinate, if you have confusion, weakness, an uneven heartbeat, numbness or tingling in your hands, feet, or lips. If you have dark urine or pale stools, nausea, vomiting, loss of appetite, stomach pain, or yellow skin or eyes. If you have fever, chills, sore throat, or body aches. Lightheadedness, dizziness, or fainting. And finally, severe stomach pain with or without nausea and vomiting. Now for this side effect here, you would you wouldn't have to get in touch with a physician right away. You could just mention it during your next appointment or mention it to your pharmacist when you go pick up your next prescription. That would just be a dry cough. The ACE inhibitors are known to cause the dry cough, so you would just switch to a different medication. Alright everybody, that's all we're going to talk about today with Lisinopril. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.